So can you sort of introduce yourself to us
Yeah,
and how long you've been working here?
right. So my name's Eric Bandoo, and I'm a Band 6 physiotherapist. So I work for Citycare Trust, and I've been working for the Trust for 4.5 years now.
Okay. And how often do you see low back pain patients in here?
I think they are definitely the majority of patients that we see. I probably would see out of a caseload of 14 patients a day, I would guess probably 4 or 5 of those would be low back pain patients.
Okay. And most of the time, well, what's the major cause of the back pain?
Back pain. There's, I'd say, quite a few are with sort of the innocuous cause where people are bent down and pick something up, and generally those sort of people who are a bit more inactive and perhaps don't do as much in terms of general physical activities, sports or sort of other recreational things. But also we do see quite a few people with office-based jobs who aren't as active and do a lot of sitting, and perhaps also we do see quite a few women who have sort of post delivery, several months down the line, who perhaps have deconditioned and then get back pain as a result of not being as active, but also doing a lot more bending activities and handling a baby.
So quite a variety in terms of activity level, would you say?
Yeah, and I mean sometimes you do see people who are active that do get back pain. So if they've done something at work, they might have got a heavy job and they are sort of loading their spine, and eventually the particular act or task then gives them back pain as a result. So they might still be very active but still get back pain as a result of their particular job.
So the current guideline is stands at 150 minutes per week of moderate intensity exercise.
Yeah.
Do you think that's a realistic goal, and do you meet it yourself?
Two questions. Yeah, definitely it is realistic because you can sort of split your activity up over a day, for example. So you could do 3 lots of 10 minutes of activity. I think it's an acceptable amount for the general public to do, of all sort of varieties of ages or conditions. So I think it's definitely a possible thing for people to do, and also a very important thing. And I do meet the 30 minutes a day. So yeah, I try consciously to make sure that I am moving around. I mean, my job that I do has elements of being physical, but then you do sit around sort of between patients as well, writing notes. So there is quite a lot of sitting to our job. So I make a point of trying to get out and exercise. So I'm doing something. If I'm not walking up and down stairs for 30 minutes, I'll go out for a run, or I'll go to the gym.
Yes.
Or I'll cycle, and that's why I got this problem. So I definitely meet, and I also think that if I'm a healthcare professional, I should be practicing what I preach. So I think it's important, but also I think that people should be able to reach 30 minutes of activity a day.
Okay. And finally, just from your experience, do you think there's a link, or indirect link between them two, low back pain and inactivity?
Yeah, I mean, I definitely agree. I think there is a definite link with lack of activity and getting back pain. Because we do know that we do as a person, we need to move as much as we can, and the back likes to be kept active, and it likes to be moved, it likes to be stretched, or it likes to be challenged. So I do think if we are inactive, then muscles become weaker, and also you can have problems with stability around the spine in terms of the sort of smaller muscles. So and also the movement or a particular job might help to strengthen up your back. So if you're in a job where you're inactive, an office-based job, for example, and you don't do anything out of your normal working sphere, then any activities, then you are likely to get back pain. So, you know, I personally believe there is a link between back pain and levels of inactivity.
Mm.